Hello everyone. Today we are going to be discussing about an important topic in neurology actually, which is called epilepsy. Uh, as we have already know that even a layman know a bit about epilepsy because of its commonicity actually in the environment, because it is very common actually in the environment. So now let us discuss the topic. So epileptic seizure actually is a kind of let us begin with the definition actually. So definition of the epileptic seizure. Before we go into the definition of epilepsy, actually, let us talk about the definition of seizure. So, seizure can be defined as actually an abnormal synchronous discharge, of central nervous system neurons. Actually, central nervous system neurons. This is what regarded as a seizure actually. So when we have a kind of recurrent seizure, so this is what we call an epilepsy. So this means not all person you see having seizure, you can say the person is having what? Epilepsy. Because if the patient is having that seizure for the first time, so you can't make a diagnosis of epilepsy actually, unless if he also come back maybe after 1 month, 1 week, after 2 days, for example, unless if he has a recurrent seizure despite treatment. So this may lead to you to diagnose the patient as having epilepsy. So what is epileptic seizure? Epilepsy is just recurrent definition of this, that is recurrent seizure. Recurrent seizure actually. So that is what we call an epilepsy actually. So now let us discuss about what causes this synchronous discharge of the central nervous system neurons, or the etiology, the causes. So for us to remember the etiology actually, we have to remember a kind of mnemonic called vitamins actually. So for the first V, it means vascular factors. For example, stroke. For example, hemorrhage actually. For example, arteriovenous malformation, AVM. All these are vascular factors that may lead to actually seizure or epileptic seizure actually. While the eye, infection, especially if the person, for example, let's say a boy is having a kind of, or had an infection when he is in the intrauterine life, that is when he was a fetus. So if the patient, the boy had an infection when he was in the uterus, that is perinatal life. So for example, toxoplasmosis, for example, cytomegalovirus, all this, that touch infection, we have touch infection actually, toxoplasmosis, syphilis, all this infection that may affect the patient or the boy when he was fetus actually in his mother. So this may put the patient at risk of developing epilepsy later in life. So for example, encephalitis, actually brain abscess. Now not only in the boy actually, brain abscess, even severe meningitis. So infection actually. So while T means trauma, so let us see T, trauma. So trauma, especially penetrating trauma, because the penetrating trauma is a good risk factor of developing this brain abscess. So leading to this, or the patient, putting the patient at risk of developing this epilepsy actually. And then the A, autoimmunity actually. So autoimmunity, for example, central nervous system vasculitis, that is inflammation of the vessels that are supplying the central nervous system actually. Because if we have central nervous system vasculitis, then definitely they may have a kind of thrombosis in the blood vessel. If we have thrombosis in the blood vessel, then definitely there will going to be ischemia. So if we have ischemia to the brain, then we have this stroke, right? And we say stroke is a risk factor of developing epilepsy actually. So that is it. Then M means metabolic factors. M, metabolic factors. So these metabolic factors, for example, hyponatremia, for example, hypoxia, hypoglycemia, also for example, hypocalcemia, hypomagnesemia. Why a patient with hyponatremia, hypoxia, and hypoglycemia, and whatsoever this condition can have seizure actually is because in hyponatremia there will going to be a kind of brain swelling, right? Because water will actually go inside the will shift inside into the intracellular cells. That's into intracellular space of the what of the neurons. That is inside the neurons. Why? Because we have the osmolality of the neurons will going to be higher because there is decrease in the osmolality of the serum actually. So if we have brain swelling, then definitely anything that may lead to brain swelling can increase the intracranial pressure, and anything that may increase the intracranial pressure can put the patient at risk of developing seizure actually. Also hypoxia. If we have hypoxia, sodium potassium pump cannot work actually properly. In hypoxia and then in hypoglycemia, right? So definitely, if the pump can't work properly, so definitely sodium will accumulate inside the neurons, and then water will shift into the neurons, and then causes brain swelling. If we have brain swelling, definitely lead to intracranial pressure elevation, and then leading to this seizure. While in hypocalcemia and the hypomagnesemia, there is going to be a kind of irritability of the neurons. If we have hypocalcemia and hypomagnesemia, there will going to be a kind of irritability of the neurons actually, because this calcium, it is one that is stabilizing the sodium channel actually. So if there is decrease in the calcium, so nothing will stabilize the sodium channel, then sodium will rush into the cell and then causes the seizure. While if there is decrease in magnesium in the body, then definitely we have a kind of receptor called NMDA receptor, which is called N-methyl D-aspartate receptor. So this receptor is a kind of glutamate receptor. This mechanism, it is the one that is regulating this. If we have decreased magnesium, then definitely glutamate will be exciting these receptors in the neurons and then causing overpairing or over discharging actually, leading to this seizure actually. So that is it. Now we have the I, which is idiopathic, which is almost, this is the most common actually cause. Then N, neoplasms, for example, astrocytoma, medulloblastoma, multiforme, or whatsoever. Then S, we have psychiatric factors actually. So that is it. This is the etiology of actually epilepsy or epileptic seizure. So now let us see the types of seizure or epileptic seizure actually. Number one, we have partial or focal seizure, and also we have generalized. We have generalized. Seizure. So when we say partial or focal, it means these types of epilepsy are categorized based on the area that is affected in the cerebral cortex. When we say partial, let us talk about it in detail. Partial, that is partial focal seizure. This only, for example, if we say this is the brain, this is the cerebrum, like this, only some kind of localized area is affected in the cerebrum, in the cerebral cortex, and also either only one cerebral cortex is affected or only a focal area in one cerebral cortex is affected actually. Either one hemisphere affected or a localized area in one hemisphere. Localized area in one hemisphere. So that is it. And then this is what we call the partial or focal. And also this is categorized into two actually. We have simple partial seizure, and we have complex partial seizure actually. All these are types of what? This simple and complex are types of this partial focal. And these are also categorized based on whether the patient is aware or is conscious during the attack. So simple, the patient is conscious actually during the attack. Is conscious during the attack. Or the patient is unconscious during the attack, so he can't remember anything. He don't even know that the symptoms occur actually. Unconscious during the attack. So that is it. So now let us see the presentation of this partial focal seizure. So that is the presentation. So this it will present as a kind of strange sensation. It may present as strange sensation, like for example, hearing something which does not exist, hearing, or taste sensation in the absence of putting anything in the mouth, but the patient will kind of actually be kind of testing something, test sensation. And also there is a kind of jerky movement actually, jerky movement of, for example, hand, because only a kind of focal area is affected. So jerky movement of maybe hand or one leg actually, or whatsoever actually. Only specific part of the body can move depending on which area of the cerebral cortex is actually discharging, right? So that is it. And also this sometimes the patient actually has a kind of static movement, that is this jerky movement can progress. Jerky movement can progress actually, can progress to involve many muscles, especially in the some side, many muscles, especially in the same side, that is ipsilateral, in the same side. For example, if the jerky movement started in the left hand actually, it may go to involve, for example, it will spread sometime, it can spread to involve the whole upper limb of the same side, and also the lower limb of the same side actually. So this condition of spreading is what we call Jacksonian match. Jacksonian match actually. This spreading, right? So that is, but it's not most of the, this spreading doesn't occur in most of the cases actually, but sometimes it do occur. All this sensation and this jerky movement occur in partial seizure, specifically mostly in this simple partial, because the patient can only present what he can remember, right? While in this complex seizure, the patient is not aware. Only maybe the witness, if there is witness, or if he has some friend behind him, then the friend can only say that yes, he lose conscious and then he started this jerky movement. But the patient can remember, right? If it is complex actually. But if it is simple, the patient will say that I experienced hearing or test sensation and then started to have this jerky movement, and then so, right? Because if it is simple partial, because his consciousness is intact. While if he lost consciousness, he can't remember anything because he don't know what happened during the attack, right? Only if he has witness. So the witness can only say that he started jerky movement, and then he lost consciousness and then started jerky movement and whatsoever. And then the witness cannot say that he feels sensation, because sensation, it can only be known by the patient, right? And the patient can't know that because he lose consciousness. So these symptoms occur in partial focal actually. So now let us actually discuss about the generalized generalized seizure. Generalized. This generalized, it involves both the hemispheres. It involves both hemispheres actually. And also this generalized is divided into actually two, into actually many, unlike in the partial one that is divided into two, but this is divided into many types actually, or subdivisions. Subdivision. So number one, we have tonic. In this generalized, the muscles of the body, all the muscles of the body of the patient will undergo a kind of stiffness. That is stiffness of whole body muscles, because all the cerebral cortex are affected. So definitely all the body will going to be affected actually, all the body muscles actually. So while we have atonic also, atonic will going to have a kind of generalized relaxation. Beyond that, atonic, that is the opposite of this tonic, right? If he has stiffness in tonic, then definitely he will going to have a kind of opposite of stiffness, that is generalized relaxation. That is, if he has generalized relaxation, he can't maintain posture, right? So can't maintain a posture. Then he may fall down, right? Because his muscles lose their tonicity. Can't maintain a posture actually. Right? So that is it. Then we have tonic-clonic. This tonic-clonic is the most common type of seizure actually. This is the most common type, and even the layman mostly know this, the tonic-clonic type, right? So that is it. This is the tonic-clonic. So this tonic-clonic actually, it started with the stiffness, started with a kind of stiffness, and then then leading to then actually progress to convulsion. So tonic means stiffness, then clonic means convulsion. So if the patient will first go a kind of generalized stiffness and then fell down and start to convulse. That is to develop a convulsion actually. While clonic, as I have already said it here, is a kind of convulsion actually. In clonic, he will only progress to convulsion, start the convulsion without having this tonic phase first, right? So that is it. So that is. So we have a kind of another seizure actually called absence seizure. Absence seizure actually. All these are types of generalized seizure. Absence seizure is a kind of the patient will a kind of lose consciousness for a milliseconds actually, or for a while, and then regain the consciousness, So this is also known as spaced out. The patient will experience a kind of spaced out. He will immediately lose consciousness, then immediately come back to consciousness actually. So this is what we call the absence seizure actually. And this absence seizure is also known as petit mal, while this tonic-clonic is also known as grand mal actually. So that is it. Then we have a kind of condition called status epilepticus. Status epilepticus. Status epilepticus. This status epilepticus is a kind of when the seizure actually, when the patient took more than 5 minutes or took a kind of 5 to 30 minute convulsion or having that a kind of seizure. So that is actually regarded as this status epilepticus, and also it is seen in tonic-clonic seizure. So when the patient took, because normally actually the epilepsy can't take more than 5 minutes, right? So if you take more than 5 minutes, which is the give range 5 to 30 minutes, that is greater than 5 minutes precisely, actually without stopping, then definitely we term this as status epilepticus, and then immediate or emergent benzodiazepine is indicated here. Benzodiazepine, even if it is the first time of his seizure, benzodiazepine is indicated. So in the next video, we are going to see the how we will diagnose, and then how you will kind of treat actually the the patient actually. So thank you very much.